What's going on, everybody? Dr. Michael Sclafani here, owner of Tideline Sports Performance and Rehabilitation. Today we're going to be talking about the shoulder joint. So we see a lot of patients and athletes in our clinic that have some type of shoulder ache or pain or tightness, and I want to be able to provide you guys a little background information about the shoulder joint, as well as a couple things that you can do to keep in your back pocket just in case you experience any type of shoulder ache or soreness or any pain at all along your fitness journey. You have some things to try on your own for some self-care management. So let's go over just the overall biomechanics of the shoulder joint. We talk about the shoulder joint, everybody just thinks about the ball and socket, or what we call the glenohumeral joint. And basically, your shoulder joint is a ball and socket joint. It sits like a golf ball on a tee, which is great because that provides us a lot of different directions and a lot of different mobility. However, it requires a lot of stability to make sure you don't dislocate your shoulder, which again happens sometimes in a lot of athletes, especially contact collision athletes. So what I want to do is just go over a little bit further about some of the other aspects of the shoulder as well, especially when we talk about your shoulder blade and how your shoulder blade intersects with your middle back that we call your thoracic spine. So when we look at the actual ball and socket or the glenohumeral joint, it's encased just like all of our other joints in something called a capsule, which is just like a big rubber band network of ligament tissue that helps to make sure that the ball stays seated in there. However, it's what we term passive mobility, meaning that you can't consciously contract your capsule. It's just something that's there to provide almost like a little bit of a rubber band or a little bounce out there as well. So for people, say, who dislocate their shoulder, that capsule gets stretched out a little bit, and they need to rely a little bit more on the musculature for active stability. The opposite is true. There's something called a frozen shoulder. The medical term for that is adhesive capsulitis, where basically the capsule becomes so stiff and rigid that people can't move their arm very well either. So again, we want to make sure that we have a good balance between enough mobility within our shoulder without promoting instability or going too far. I will tell you this, the majority of the people that we see oftentimes lack some of the mobility within their shoulder rather than stability. But again, if you come into our clinic, we'll be able to help answer that for you. Now, we talked about how the rubber bands or the capsule all sit together for that ball and socket joint, and we term that passive mobility. What I'd like to do now is talk about what things provide active mobility, and that's primarily your rotator cuff. So your rotator cuff is composed of 4 muscles. There's one in the front, one on the top, and 2 in the back. You can consciously and subconsciously contract those muscles to help give your shoulder joint a little bit of stability when you do a push-up or bench press, when you do anything overhead, if you are playing basketball and you jump up and you go to slap a ball right out of the air. That's a lot of active mobility that your rotator cuff is going to provide for your shoulder to make sure that you don't get hurt. So what we want to do as well is we also want to talk about how your shoulder blade intersects with your thoracic spine. Your thoracic spine is a little bit different than the other parts of your spine, like your neck, your lower back, and your tailbone, in the fact that you have your rib cage that attaches to it as well. So when we see patients in our clinic, we want to make sure that they have enough mobility within their thoracic spine or middle back and enough mobility along their rib cage as well. You have small joints within your back, right? In our low back pain video, we talked a little bit about how those facet joints or those building blocks are stacked up together. You also have a small joint between where the rib intersects with the thoracic spine as well. So now we kind of have almost 2 joints that we want to make sure have enough mobility to provide some of the movement around the ball and socket joint. A lot of times we talk about things as a kinetic chain. A lot of people are familiar with the posterior chain, which is your lower back, your butt, and your hamstrings that work together when you do something like a deadlift. Well, in your upper body, you have a shoulder chain, right? And that's composed of your thoracic spine, your middle back, the back of your rotator cuff, as well as your middle deltoid, one of your shoulder muscles. So what we see a lot is any dysfunction along either one of those 3, your thoracic spine, the back of your rotator cuff, or your deltoid muscle, you're going to get some type of compensation somewhere else. The majority of our patients have a lot of dysfunction along their thoracic spine or their middle back. Your middle back makes sure that you don't look like a hunchback and that you're also not able to just sit upright and feel like a big wet noodle while you're floating around as well. So what it does is it provides you a little bit of stability, also encases your lungs and some other organs as well. So we want to make sure that, again, that it has enough mobility with as much stability as we need as well to perform our physical activities. So let's go over 3 things that you can do on your own if you start to experience any shoulder pain or any shoulder irritation or soreness, or you want to improve your performance related to the shoulder joint. The first thing that we want to do is we want to make sure that we address true overhead mobility, right? So a lot of times what we see is people are able to raise their arm all the way up overhead, but they end up bouncing out a little bit away from their ear. True overhead mobility keeps your bicep close to your ear as you raise all the way up. Now, we have 3 requirements for true overhead mobility. The first requirement is the capsule of your shoulder joint. We talked a little bit about that earlier. The second requirement is that you need to have a lot of lat mobility underneath your arm to make sure that you're not getting this push and pull. Your lat's function is just like a lat pull down or a pull up. Its job is to pull your arm down towards the center of your body. If you have a lot of tightness in there, you won't be able to go the opposite direction, which is all the way up, and that can cause your arm to bounce out, or you can lean backwards, or you may not be able to finish an overhead movement. The third requirement is enough mobility in your thoracic spine or your middle back. We talked a little bit about that earlier. We need to have enough mobility in all 3 of those areas to make sure that our arm is able to go all the way up in a true overhead movement without bouncing out towards this Y or diagonal position. So the first thing that we want to do is we're going to grab a small dumbbell, really light. We're going to bend our knees, and we're going to have in a thumb up position, we're going to bring the dumbbell straight up overhead to allow you to stretch out that lat, a little bit of that upper back, and a little bit of that joint capsule as well. All right, the weight does not need to be heavy. Most people start anywhere from 2.5, 5, maybe 10 pounds if you're a stronger or bigger individual. And we want to do that just to help give us a little bit more true overhead mobility. The second thing that we want to do is we want to make sure that we address mobility around your upper back or your thoracic spine. So for this next exercise, what we're going to do is we're going to come down onto all 4s, and we're going to grab a light mobility band attached to a rig or a cable column, and we're basically going to reach across as far as you can, pull that handle to your upper abs or the top of your stomach, and then rotate away. We're going to make sure that we do both sides to make sure that we have enough rotation and enough mobility through that middle back to accommodate anything like a bench press or a chest press. As you come down, you want to make sure that you have enough mobility in your upper back to accommodate any small deviations for that. Now, the third exercise that we're going to go over has to do with the back of your rotator cuff. So again, one of those 3 things along that shoulder kinetic chain. The back of your rotator cuff is responsible for this high 5 position, or moving your hand into external rotation away from your body. So what we're going to do is we're going to sit on one side. We're going to prop your elbow up on top of your knee. We're going to grab a light dumbbell, again, maybe 2.5 or 5 pound dumbbell. And what we're going to do is we're going to gently let that dumbbell come down, and then we're going to actively pull all the way back up. This is designed to activate the back of your rotator cuff, which again will give you a little bit of that active stability as you go into different movements with your shoulder. Now, we're talking a lot about these 3 exercises, and notice how these 3 exercises are what we term active mobility. We have another video where we went over some of the differences between active mobility and passive mobility. But again, just to kind of come full circle with the shoulder joint, things like foam rolling and flopping around for your upper back, or foam rolling your lat and the back of your rotator cuff, or maybe smashing a lacrosse ball back there, that is not necessarily an effective way to improve the mobility of some of those shoulder joint musculature, okay? Especially for your back as well, doesn't necessarily tolerate just getting cracked on or crunched on either by a chiropractor or one of our guys, or on a foam roller. Again, same thing like a massage gun, lacrosse ball, foam roller. Those aren't necessarily good ways to warm up your shoulder prior to working out, all right? They don't actually provide any type of active mobility or any active stability for your shoulder. And so what we really want to make sure is that we prime our body prior to working out with some type of active intervention, which are some of the things that we went over. One of the things that a lot of people like to do is they'll grab, say, the rig, and they'll pull down to try to stretch their lat because they feel tight, or maybe they'll do something like a sleeper stretch or a cross body stretch to help them stretch out the back of their shoulder. Again, that's passive. Your body's not actually doing anything. You're just cranking on it with some external force like gravity or the pressure of your other arm. Make sure that your warm-up involves some type of active mobility. These 3 exercises that we went over will help you with that. But if you guys have any questions at all, feel free to reach out to us or one of our team, and we'd be happy to help you out.